Is it implantation bleeding or is it a period? How to know what is happening in your body during implantation and what signs to look for. Hi, friends. I'm Dr. Natalie Crawford, a board certified OBGYN and REI, so I'm a fertility doctor. And today we're talking about what happens in the luteal phase, specifically with implantation, and what signs could be a potential early pregnancy. As always, thank you so much for being here. Please like, share, subscribe, comment on this video, and also check out my new book, The Fertility Formula. In order to understand implantation, we have to roll the clock back and understand what's happening with ovulation so we can discuss this. So, what I want you to envision is that inside your ovaries, all the eggs. Remember, you're born with all the eggs you're ever going to have. And then what happens is when you have the start of a month or the start of a cycle, your brain is going to send out a hormone called FSH. And FSH is well named follicle stimulating hormone. FSH's job is to get a follicle to grow. Each egg is microscopic and grows inside a follicle. So I like to think about the follicles as the houses. So it grows inside there. What's going to happen is your estrogen level is going to rise as the follicle is getting bigger and the egg is getting more mature. What's so interesting is that the brain doesn't know what's happening inside the ovary. And this is an important point when it comes to understanding implantation. The brain is simply looking for hormonal signals to tell it what to do. So if we can imagine your hormones are text messages between friends, you don't actually know what your friend is doing, you're waiting to be told. Your brain is waiting to be told that there is a mature follicle, and the signal for it to hear is estrogen. It's actually a very specific amount of estrogen. It's 200 picograms for 50 hours. So estrogen high enough, long enough tells the brain, hey, we have a mature egg. The brain has to be able to interpret this and respond appropriately. The brain is going to send out a surge of a hormone called LH, or luteinizing hormone. This first surge allows the follicle to rupture. So it's a cyst that bursts. The egg is released, and then the follicle is going to reform. And now that's ovulation. And then we're entering into the luteal phase. So the first half of the cycle is the follicular phase when a follicle is growing and estrogen dominant. Second half is the luteal phase. And this is when that follicle that has been reformed is now the corpus luteum, and it is going to make progesterone. Few super important facts. Progesterone production is stimulated by LH. The same hormone that causes it to ovulate is then released in pulses throughout the entire luteal phase. So progesterone is also made in pulses from the corpus luteum as well. Progesterone is essential for implantation. The implantation window actually opens and closes with progesterone. So too little or too much can prevent implantation from happening. And progesterone is essential until the placenta is all the way grown in around 9 to 10 weeks. We know this by studies where they actually took pregnant monkeys and took out their corpus luteums and they lost the pregnancies. So progesterone is crucial. If you get pregnant, what is going to happen is that pregnancy starts to make a hormone called HCG. And we know this. This is what you test for a pregnancy test. HCG and LH share a same receptor. So what you might have heard before is that if you get pregnant, it rescues the corpus luteum. What that means is that now the pregnancy is going to make HCG. HCG binds to that same progesterone producing receptor and stimulates production of progesterone. What's happening at the follicle level before you get HCG is the egg, after ovulation, must be fertilized within 24 hours. After that, it is going to grow and develop actually in the fallopian tube. Those first 5 to 6 days of growth all happen in the fallopian tube before it enters into the uterine cavity. And in fact, when we do IVF, this is the stage that we are replicating. We're taking eggs out of the body, mixing them with sperm, and it's that fallopian tube development stage that is happening in the lab. And then we put an embryo back in the uterus. When the embryo is at the stage called a blastocyst, blastocyst is around 300 to 500 cells. It has separated out into what will become the placenta and what becomes the baby. This is the implantation stage embryo, typically considered to be around days 6 to 9 after ovulation. Ovulation day 0, the next day is day 1. So around day 6 to 9 is what we consider the typical implantation window. What's happening with implantation? I want you to think about this really quickly. We now have this embryo coming in, and it is going to oppose our wall, the uterine wall, and then it's going to adhere. And then it has to start releasing these little enzymes, these proteases that are going to allow it to invade into the wall and connect to that maternal blood supply. This is the start of the placenta. Implantation is the start of placentation. So when this is happening, you can get bleeding because we're eating away at the maternal blood vessels waiting to get this connection. And this is what we refer to as implantation bleeding. It is typically isolated and different than period bleeding. It's also different than luteal bleeding, which also needs to be discussed. Implantation bleeding typically happens in this day, 6 to 10 after ovulation window. It is usually going to be pretty light. It might be pink, it might be brown, it might be a very light red. It's usually short, only a couple days. There's not going to be clots, and typically doesn't get very heavy. Versus if we think about bleeding that might happen when it comes to your period, which of course is going to be heavier in flow, normal to have clots, and should be associated with more cramping. As a side though, cramping or pain can happen with implantation. Again, this is not a painless process. And I was shocked every time I got pregnant at how much it actually felt like a menstrual cramp to my brain, even though the placenta was just growing them. When it comes to implantation bleeding, though, you shouldn't have it every cycle. You're not going to get typically an implantation every cycle. And so luteal bleeding can also be a thing. It can be a representation of a couple main things, one of which can be what we call luteal phase defect. Luteal phase defect is defined as from the time of ovulation into your next period of less than 11 days or having spotting during the luteal phase. If we go back to what we think about before, if the ovary signal to the brain is inappropriate, maybe the brain can't interpret it well, maybe there's insulin resistance or chronic inflammation or autoimmune disease. If the brain has static interference in the radio, it's not going to interpret signals and not going to send them out correctly. So I like to think about if the LH signal is maybe not as strong as it should be, we're not stimulating enough progesterone production. This is the first sign of ovulation dysfunction. Even though supplementing with progesterone can be helpful, the real treatment is getting you to ovulate better and, of course, requires an evaluation of underlying causes, notably thyroid, prolactin, PCOS, hypothalamic disease, variety of things. So we always want to look for a root cause if we're not having a luteal phase of the appropriate length or we're having constant spotting. Ovulation induction with Clomid low dose is my favorite in this scenario to help you get pregnant. Second, though, is a polyp. An endometrial polyp or fibroid can cause luteal spotting consistently. The reason why is after progesterone is made, it changes the architecture of the uterus, it compacts it down, prepares it for implantation. And if there's an underlying anatomical issue, that can result in some bleeding. So we always want to make sure we're evaluating for that if you have consistent luteal bleeding every single time. I often see people think if they have implantation bleeding that the gig is up. They say, I have bleeding, that's my period. If they're in fertility treatments, they may stop progesterone, and that might be the absolute worst thing to do. They also might start acting non pregnant. And if you know me or you've been a patient, one of my favorite phrases is pregnant until proven otherwise. After you have an embryo transfer or after ovulation, when we know that you could be pregnant, let's act like we're pregnant. So, another one is that cramping one. So, another myth is that if I have cramping, it's definitely not implantation. So, that's not true either. The other thing to know, though, is that as soon as implantation's happening and HCG is getting into your blood system, it is now changing progesterone production. So remember I said the corpus luteum is making progesterone in pulses. This means I can't just draw a progesterone and say, oh, it's more than this, it's normal or it's a good level. Checking progesterone luteally is not how we diagnose luteal phase defect. But once a pregnancy comes in, HCG now binds that receptor constantly. And in fact, a normally progressing pregnancy, that HCG is going to double approximately every 2 days. So now I have a stimulus that's constantly rising, telling that corpus luteum to make more and more progesterone. So we do tend to see in that second half of the luteal phase or after this implantation timing, an increase in those progesterone based symptoms, which can be bloating, fatigue, breast tenderness, sensitivity to smell or taste. Smell sensitivity was my tell every time I was pregnant. I just could suddenly smell everything that I couldn't before. So that can be another thing that could clue you in is that now you're making more progesterone. Because this progesterone nuance, it's worth it to end by saying, what came first, the chicken or the egg? Meaning, if you're having a pregnancy loss and you get a progesterone level drawn, it is probably low. The reason why is this is how a pregnancy communicates with your body that things aren't growing normally. Meaning, if HCG is not rising and doubling, it's not stimulating quite as much progesterone. That can lead to a miscarriage. And this is how your body can resolve a pregnancy to get another cycle out and give another chance. And genetically abnormal or embryos that are not dividing and growing perfectly tend to not secrete as much HCG, therefore, they don't stimulate as much progesterone. So, this is one of those things just to think about is that if somebody says, okay, well, we'll just give you progesterone the next time because your progesterone was low, it's not wrong, but it's better to start it after ovulation if your body really needs progesterone and to think about how is your luteal phase and characteristics? Is it long enough? Do you constantly have spotting? Because we want to rule out structural issues or we want to look for any hormonal problems that maybe ovulation induction would be something better. Hopefully, this helped you learn a little bit more about implantation and the 2-week wait, and ask questions below. Don't forget to check out the fertility formula.